Good day. We are Group 2 and we are here to present our case appraisal for nematodes, a case of enterobiasis presenting as PTSD, a curious case of the infection with predominant mental health symptoms, presenting for the first time in the setting of a war refugee camp.
We describe a case of oxyriasis that occurred in a refugee camp in Alexandria, Greece. There were 390 immigrants living in the camp. Most are from Pakistan, Iran, and Syria. The camp's subpar sanitary conditions create the ideal environment for the growth of Ivermicularis. Living in non-apartment shelters in crowded conditions as well as unhygienic surroundings and failing to wash hands before meals are some important variables that can raise the chance of contracting enterobiasis. The frequency of Ivermicularis in children has been extensively studied. However, until recently, there was no information linking the incidence of this ailment to children living in refugee camps. In the middle of October, a 10-year-old Syrian girl and her father made a visit. The girl experienced modest and widespread stomach pain and insomnia. Her appetite has also declined and the girl's abdomen was a little sensitive. She was also subfebrile at 37.2 degrees Celsius and she also experienced nausea and vomiting. Her clinical evaluations revealed that she was severely malnourished. Her signs of insomnia, anger, food avoidance, and decreased appetite seem to point to a mental illness, most likely post-traumatic stress disorder or PTSD, given the brutal background of the conflict she fled in Syria. The daughter and her father returned to the doctor at the refugee camp after a few days, claiming that the girl's symptoms had significantly worsened. This time, the girl also complained of itching in the perianal region in addition to sensitivity and a mild diffuse abdominal pain. The girl's clinical checkup revealed no abnormalities, but a closer look at the anal region revealed scratch-related scars. The patient first displayed mental health symptoms which had never been described in oxyriasis.
So moving on with the diagnostic and assessment methods as well as the clinical conditions, there were multiple parameters utilized to test the patient. These include the physical examination, CBC, adhesive tape test, McBurney's, blood glucose level, ultrasound, and urine test. Most of the parameters in the assessment methods were under normal conditions and no pathological signs were detected. However, for the physical examination, there was a slight and soft painful area in the abdominal part of the patient, which is located in the lower right quadrant. And for the CBC, there was a slight elevation in the white blood cell as well as there were signs of eosinophilia. So as mentioned earlier in the patient's history, the symptoms of the patient became worse over time. It became severe, which led for the doctors to conduct adhesive tape tests. So the adhesive tape tests were conducted through 3 consecutive mornings, and the results were positive, which resulted to the detection of oval-shaped eggs under the light microscope. Through this, the patient was diagnosed with enterobiasis.
For the intervention, the family members of the patient were informed by the doctors and researchers that they must maintain proper hygiene. This is in order for them to stop the spread of the ailment. And when they were subjected to the tape test, it was observed that they had negative results, meaning they were not infected with the parasite. The treatment given to the patient was an albendazole. This was used for treating her enterobiasis. She was given a total of 2 dosages, which will be taken in a span of 2 weeks or a 2-week gap from each other. For her post-intervention, the patient exhibited no symptoms in the span of 3 months, and during her post-checkup, she showed no signs of recurrence. Therefore, she was already feeling better.
While albendazole poses a risk of side effects such as rashes, hives, headaches, nausea, vomiting, and abdominal pain, the patient in question exhibited no adverse events nor any undesired effects after the 2 doses 2 weeks apart.
Okay, so to generalize, because of the unsanitary conditions that are present in refugee camps, medical doctors should not exclude helminth infection when prognosing patients, especially those who are pediatric and who are more prone to experiencing fatal symptoms or more rare occurring symptoms of enterobiasis infection. Moreover, laboratory test results that indicate a possible infection must not be overlooked in order to have a more accurate diagnosis.